Hey everybody, welcome to Pharmacology, the Intro to Pharmacology. My name is Jamie Hardy and I'm going to be your guide as we go through this process. Isn't that a lovely scene? I just love that sunset. All right, let's get started with our first little lecture series. The first thing I want you to understand is that any time that anyone ever gives you an objective, okay, and they write them on the screen for you, that's something that you need to pay close attention to. These objectives are actually going to be tied to either learning activities to our ultimate course objectives. So treat these as little insights into the wide world of the test that's coming up. So what I would do with these is it says compare and contrast therapeutics and pharmacology. I would go to my textbook and I would take that objective and then I would write little bullet points of things that you've learned about that topic from the textbook, because I guarantee you that's a test question. I will tell you that I wrote 6 objectives for this lecture, and based upon those objectives, those are going to be your test questions. So those are the 6 test questions, okay? Now, am I going to ask them just like that? Am I going to say, hey, explain the differences between trade names and their generic equivalents? No, but I am going to ask you some information about that topic that I want you to be able to tell me about. So pharmacology. I believe that pharmacology is one of the most important classes that I ever took as a nursing instructor, as a nursing professor, as a family nurse practitioner. I will tell you it was also one of the most difficult classes I took because it was my first introduction as a nurse to the terminology, to the things that medical people say. So it can be a little daunting. But how do you eat an elephant? And the answer is one bite at a time. When we look at what we as nurses need to know about how to administer medications, okay, this is a nursing drug guide. This drug guide, if I can look up any single medication in it, it's going to tell me everything I need to know about that particular medication, where it goes in the body, how it does its thing, what the response is that's supposed to be produced. So I need to know this information before I start passing out pills or IV medications or anything else to any other patient. So very important that I take this information seriously and that I always consult my drug guide until I am aware of what needs to happen. We always want to give medications with the thought process in mind that this medication is going to improve this patient's quality of life. Now, I know that some of you are probably pulling from some personal experiences and you're like, well, I had a grandmother or a mother who had cancer. And the drugs that they gave her was just awful. They lost their hair, they were nauseated all the time, they had all these horrible side effects. Well, what we have to remember in situations like that is that sometimes the treatment for those types of diseases can have a lot of really bad side effects. But ultimately, the goal was to kill the cancer or to cure the cancer so that we can have a better quality of life. So just remember that if we're giving a medication to a patient, ultimately the goal is to improve the quality of life for that patient. So you may be asking yourself, like, what is my role or responsibility in medications as a nurse? Well, there's 3 of them, and I need you to write these down. We need to educate the client about the medications that they're going to be taking, the who, what, when, and where. They need to be able to manage their own medications. And then we assist in the monitoring of those medications. So educating, managing, and monitoring, those are our 3 primary responsibilities about medications. So with education, if I can explain to you why I want you to do something in the order I want you to do it in, then what's going to happen is that you're going to be more likely to do it if you find value in it. If I can get you to manage your own health, I can make you healthier because you're doing it yourself. It's part of your routine, part of the thing you're going to do. Then there's the monitoring aspect of this. What was that medication supposed to do versus what did you, the patient, experience it to be? And then what do I see as the provider looking at the patient saying, well, what happened when we gave those medications? So these are important things for us to understand, that we are educators, we manage, and we monitor the medications. Remember, learning pharmacology is going to be a gradual, continual process. This is the first course that you probably are going to need to remember that you're going to have to take this information with you when you go. You can't just take a whole bunch of notes in this class and read the textbook one time and think that that's going to all just kind of go poof and it's going to be in there. This is stuff that you're going to be using on a daily basis in your practice as a nurse in order to be able to treat patients better. Some of the key terms here that come out of this textbook, come out of this text, this particular chapter, these are the key terms that you need to learn and to put into your head, because we're going to be running back and forth with these terms all the time. What does the word therapeutics means? What does pharmacotherapy means? What's the difference between a drug and a medication? I thought they were the same thing. This is all good stuff that you need to put into your brain. One of the things that we try to do to make pharmacology a little less daunting is we try to come at pharmacology and kind of put things into like groups of things. For instance, if you go to your pantry right now, I bet there's a shelf where you've put all of your cans. And then over here is a place where you put your bags of chips. And then over here, maybe in your can section, you have a place for the fruit and then the veggies. And then over here is your boxes. You have those kind of grouped into classifications. So we try to do the same thing with pharmacology. So we have therapeutic classifications, pharmacological classifications, and then how they physically work. So it's kind of like when we were learning in biology about how, things come in classes, then phylums, then so forth and so on, based upon their different characteristics. So learning drugs are going to be the same thing. We're going to have therapeutic classifications, pharmacological classifications, and then we're going to talk about how each one of them work. Probably the easiest way to understand a specific drug when it comes to like the pharmacological classification is to understand a prototype drug. So this is like one representation of the entire class. So I like to kind of make a cultural, sorry, they're mowing outside. But I like to make a a cultural reference here to kind of help you understand a prototype. So a prototype is like one representative that would kind of explain the whole class. So for instance, if my last name was Hernandez, Rodriguez, or Garcia, you would assume that I'm probably Hispanic in culture. So you would make a generalization that maybe my family celebrates Cinco de Mayo. I like to eat tortillas. I like to eat salsa. I'm fond of margaritas. You make that kind of that generalization about me and my family based upon my last name. Well, a prototype drug pretty much does the same thing. It's a representation from that whole class of medications. So one of the prototype drugs that we'll be studying about this year is called enalapril. It's known as it's an antihypertensive. It's an ACE inhibitor. Excuse me. And when you tell me that a drug is an ACE inhibitor, that tells me what its mechanism of action is, and we'll get more into this later, okay? But enalapril is the prototype for this whole class. But I'll tell you that it may not be the drug that's most often prescribed in the community. Enalapril is a very old ACE inhibitor, and it's not that it's not good, it's still good. It's just that we tend to see a lot more lisinopril in the community. But we won't make lisinopril our prototype. We're going to learn the prototype as enalapril. Okay? I know this seems a little confusing. Just for right now, just capture under the fact that a prototype is a representation of one of the classes. It's like the spokesperson. It is the class president for its division. Okay? Now, one of the things that gets a little bit confusing when we talk about drugs, and the reason why I put this slide up here, is that drugs typically have two names. So as you're thinking about this from a real world scenario, I want you to think about the Oscar Mayer wiener. Now, some of you are probably too young to remember this, but there used to be a song that said, "My bologna had a first name, it's Oscar." Okay, drugs are the exact same way. They have a first name and they have a second name. So the first name is typically their trade name. It's something that we can all say. So the trade name for enalapril is Vasotec. What was great about the name of Vasotec was that everyone could say it. And the other thing was too, is that the trade name kind of gave us a little bit of an idea of what that medication was doing in the body. Because Vasotec helps to vasodilate, which is a fancy word that means to dilate blood vessels, out here in the periphery, okay? So it was a vasodilation medication, and it was used to treat blood pressure. Sorry, I have a horrible frog in my throat. But its generic name, or sorry, that was its trade name, that was called Vasotec. Its chemical name was called enalapril. So chemical names are also sometimes called generic names too, because once they lose their patent and all this other fun stuff that we'll talk about later, they get this. They usually just go by their chemical name. So enalapril tells me how this medication is working. That last little bit of that medication, that PRIL, tells me pril. That tells me where that medication is working. It's like it's the last name of the drug. So again, if my name is Jamie Garcia, you make the assumption that I am Hispanic and then all these other things. Well, by having the last name of pril, it tells me that it's an ACE inhibitor. So we have to learn both names. I will tell you that on your, at the end of nursing school, you're going to take this big, huge exam, or end of nursing school, end of paramedic school, end of LVN school, it doesn't matter. Any healthcare profession that you go into, at the end, you have to take a certification or a board exam. On that exam, because those exams tend to be nationwide, they don't put the chemical or the trade names on there. So you wouldn't see it written as Vasotec and Vasotec and enalapril. You would just see enalapril. The Board of Nursing especially expects that you recognize that drug by its last name, that pril part of that drug, okay? The other thing you need to know is that sometimes we take drugs and we make them combinations. We take two drugs and we squish them together. Well, an example of that is the drug called Vasoretic. Well, what that tells me as a healthcare provider who's been around forever is that it's going to dilate, and the uretic part tells me that it has a diuretic in it. A diuretic is a medication that makes the patient pee off excess fluid and helps to drop their blood pressure. So for this one, the chemical name of this one is enalapril and hydrochlorothiazide. Now listen, hydrochlorothiazide is a very long name to spell and to say. So sometimes you'll see healthcare professionals will shorten it to HCTZ. Oh my goodness, my throat, sorry. So you'll see them write it like that, okay? So enalapril with hydrochlorothiazide, also known as HCTZ. So the whole point of this conversation is to get you to start to think about how incredibly important it is to recognize the structure of a name, that a name is going to tell you a lot about the drug, and to understand that you have to learn both the chemical structure and the trade name, okay? Typically, the chemical structure, the chemical name, aka the generic name, tend to be more helpful in learning more about the drug than just learning the brand name. So prescription medications are drugs that require that you get a prescription or a written order from a person who has legal authority to write a prescription. So that includes medical doctors, doctors of osteopath, nurse practitioners, and physician's assistants, dentists. And there's more, but basically they have to have a legal authority to write a prescription. This is all the elements of an RX. I like to kind of show you this because we don't do a lot of handwritten scripts anymore. A lot of them are digital. But when you do have to write them, there is certain things that you have to be on there. So I just kind of wanted to give you that like snapshot of one. Over-the-counter medications. Oh my goodness. Have you been to the pharmacy lately? There's so many over-the-counter medications for you to choose from. There are medications for your stomach. There's medications for fever. There's medications for pain. There's medications that you can buy over the counter for weight loss. There's so many different ones. The good news is that there's a lot available. The bad news is there's a lot available. And sometimes patients don't always know what to take. So if you haven't had a chance in a while just to kind of go and sit down and peruse through a pharmacy, it's a really good thing just to go and see what's actually out there. Like just go in there and just study the medications that are on the shelves. Because I guarantee you, as you're taking this class, you're going to have so many patients or people in your own life who are going to say, so what do you think about this medication? So we'll talk more about over-the-counter medications as we go through the course. I'll point them out when we hit the different sections, but there are so many that you can purchase. The most underutilized resource in the entire world, people, is a pharmacist. So if you need information about a medication, whether it's good, bad, or going to interact with something, you go to the pharmacist. Man, those people are amazing. Okay, don't forget your pharmacist. So I told you a little bit about generic versus brand. So let's talk just for a minute. It's very, very expensive to develop a new drug. Like so expensive that because those medications can be in process for up to 10 years before they actually hit the market. Because of the cost of making those medications, they can be very expensive. So let's take a medication called ondansetron, also known as Zofran. And that's the reason why we have generic and trade names. So with the brand name of Zofran, when it first came out on the market, that pill was $250 per dosage. Okay, per dose. And it was reserved for only patients who were experiencing nausea related to chemotherapy. So what happened is after several years, after 10 years, usually 7 to 10 years, the patent on the brand name falls off. So then at that point, the company or other companies who've been waiting and watching and figuring this medication out, they can then begin to make generic drugs or look-alike drugs. What's important about a generic drug is that the bioavailability of the drug has to be exactly the same. They have to work the exact same as their trade, and they're a lot cheaper. So literally a tab of Zofran went from $250 per tablet to being $10 a tablet. And then it went to $20 a tablet. Then it went to $10 a tablet. And now you can get an entire Zofran prescription for less than $5. So I will say, after saying that, there is something called a negative formulary list. This is a list of medications that even though the brand has run out, when they made the generic equivalent, it doesn't act quite the same. In the state of Texas, we don't have a negative formulary list. However, if you practice in other states, like in the state of Florida, there are some medications that are on the negative formulary list, meaning that you cannot substitute one for the other. I recently ran into a lady actually who was taking a medication called Synthroid, that's the brand name, and the generic is levothyroxine. She is not able to take the generic levothyroxine because for whatever reason in her body, it does not work the same therapeutically. She is a brand-only patient. So when the physician writes that order, he writes for Synthroid, and then underneath it, he has to designate brand only. There is no, and for this particular patient, there is a substance in the generic equivalent that actually causes her to have hives. So she can't have the generic, she has to have the brand. But anyways, negative formularies do exist out there. There are drugs that say that we can't substitute brands for generic, but almost 100% of the time in the state of Texas, we're able to do that. I'm going to click pause for just a minute. All right, sorry about that. Okay, so let's talk a little bit about pharmacoeconomics. So one of the things that I want to kind of impress upon you guys as you're going through everything is that just to be thinking about the patient and can they actually afford their medications. We have some incredible medications out there and they work fantastic, except they are so costly that the patient actually can't afford to purchase them every month. Therefore, they won't take them. One of the big things that I'm finding right now in the community is we have a lot of patients who are rationing their insulin. So for instance, let's say that a patient is supposed to take 40 units of Levemir a day. Don't worry about the drug, just go with me. On the Levemir medication, that prescription for that drug is very, very expensive. Like if you were just to cash pay that, it's $350 a month. So what the patients do is instead of taking 40 units a day like they've been asked to do, they'll take 30 units or 20 units because they try to ration it out so that it'll last longer, okay? The other thing I want you to recognize is that there's a couple of apps that you can get on your phone. I love a good app. There's this thing called GoodRx. It's an app for your phone, and you can go in there and you can put in any medications. Let's put in Levemir because we were just talking about that one. And I click Levemir, and it says, hey, how much do you want? I'm going to say I want 5 pens because that usually lasts a patient a month. Right now, with the coupon, it's $487.32. Okay, ridiculously expensive. So we need to use our pharmacoeconomic principles whenever the patients are going home on medications from the hospital, from a clinic, from a community center, wherever they're at. We need to ask them and say, hey, look, let me look up your medication just to kind of see what the price of it is. Can you afford that? A lot of our major retail pharmacies have programs. Walmart, CVS, Kroger's, Brookshire's, they all have programs that help to get their patients medications for $4, $5, or $10 a month. Kroger specifically right now has a good program. You pay a one-time monthly fee, and then some of your medications you pay a one-time fee, not monthly. You pay a one-time fee, and some of your medications are absolutely free. For instance, right now, if you pay the one-time fee at Kroger, you can get metformin, which is the most popular diabetic medication that's taken orally, for absolutely free for the entire year. So it's a good deal. So always be thinking about that. If you have an opportunity and you have maybe a mom or a dad, or some of you may already take your medications yourself, you may want to ask them, like, what medicines do you take? And then take a minute just to see what that monthly cost is. As we send these patients into the community, if they can't afford them, they're not going to take them. If they're not going to take them, then why are we prescribing them? So needs to be why are healthcare providers prescribing them? So need to be thinking about that. The last thing I just wanted to encourage you about is pharmacology. Okay, this is a drug guide. This is a guide that has every single one of the medications in it that we could possibly give our patients. This is a lot of information, okay? And this can feel very overwhelming. I want to tell you that the way that you eat an elephant is one bite at a time, okay? It is a long process. This is a class that you're not going to just be able to just take one time and then walk away and go, ha, I passed the test. No, this is something that we're going to need to continually do over and over again in order to really get this information tucked into our brains. So use your objectives to write out a great little study plan for yourself. Define the terms in the chapter. Read the chapter. Okay, this is actually a class where you actually have to read. And then use all that information to help yourself study for the exam. I recommend that once you take a chapter, write out your objectives, then you revisit those objectives and those answers that you gave yourself on a daily basis until we take the exam. And then I want you to touch them at least once a week until we get to the final examination. Okay, these are all good things. They'll help you to get through this class with the grade that you are wanting. All right, guys, that is the end of the intro to pharmacology. If you have any questions, please post them to the discussion board or send me an email. Let me turn off the camera.